right. Get everyone in here. All right. Senator Schumer is going to be joining us shortly. I want to thank everyone for being here to talk about something that couldn't be more important, and that is the costs that we're seeing for prescription drugs and the work that must be done to keep bringing those prices down. With us today will be Senator Schumer, our leader, Senator Shaheen, who has long fought the fight on health care, Senator Welch, who led the bill in the House of Representatives on the prescription drug negotiation, Senator Gallego, one of our newest senators, Senator Alsobrooks, also new, we welcome her today, and David Welch is with us, who's going to share his personal story, and Anthony Wright, the Executive Director of Families USA. This has been a top priority for Democrats for years. It is Democrats and only Democrats that got the prescription drug negotiation bill through the Congress. As you know, it was part of the Inflation Reduction Act, and we believe that no one should be forced to choose between filling their prescriptions or filling their refrigerator. That's why Senate Democrats ended Big Pharma's 20-year sweetheart deal and finally let Medicare negotiate prices under Medicare Part D. And last year we learned that the new prices for the first 10 drugs, you remember when they were announced by the Biden administration and they actually did the negotiations are done, they will save 9 million seniors, 1.5 billion in out-of-pocket in just 1 year. I think many of us that worked on this did not realize how much savings there were. We talked about it a lot. We looked at the drug prices. Some of these drug prices are going to go down 70%, 60%, 80%, and that was what negotiations were all about. So this last week, the Biden administration, previous administration, announced the next 15 drugs that should be negotiated. That includes Ozempic, millions of people on that drug, as well as other weight loss drugs. This work is important because it is now going to be taken over by the incoming Trump administration, and we're going to hold them accountable for actually following through, not only on negotiating the 15 drugs that are already out there, but also on putting forth the new drugs. The law that we passed, and it is baked in the law, requires 15 more drugs, then 15 more drugs, then 15 more drugs. So more and more seniors will be able to experience this cost saving, which is so crucial right now. We also, of course, put in place the $2,000 cap on Medicare expenses, out-of-pocket expenses, the insulin monthly cap, as well as free vaccines. So what have we seen from the Trump administration in one day? Well, he signed an executive order that cut Affordable Care Act enrollment period short and reversed policies that made it affordable for parents to add kids to their health insurance. He's also making it harder for 24 million people to keep coverage year to year. They revoked the automatic re-enrollment in the Affordable Care Act. I think anyone that knows what it's like to have to re-up things at the end of each year knows that's going to be very damaging. He's also taking away new initiatives that are lowering drug prices, including one that offers seniors a flat $2 copay. We will find common ground when we can with Republicans to reduce drug prices, but we will stand our ground and fight back if they try to undo the progress we have made and give pharma a sweetheart deal. Donald Trump wants this to be a golden age. Those were his words, right? A golden age for America. But is that a golden age for the people of this country or for the billionaires and the oligarchs that we saw at the inauguration and all of the people who are already doing really well and not going to care how much their drug prices are? My colleagues and I are going to fight back to make this golden age and make the point that this golden age cannot be for rich people, that it's got to be for regular people. And we're going to fight them at every point if they try to raise the price of prescription drugs or bring back this sweetheart deal that we worked decades to end. And with that, I'll turn it over to our leader, Senator Schumer.
Thank you. Thank you, Senator Klobuchar, and thank you for your great work on these issues. She's been fighting these issues to get prescription drug costs lower for decades, even going up to Canada, which was very far away from Minnesota. It was a long trip, but she still did
You
it.
can see it from our porch.
I know. In any case, and I want to thank all of my colleagues for being here, and I think two of our colleagues just had one re-election, Angela Alsobrooks and Ruben Gallego. They can tell you how much people cared about this issue. Anyone who's out there knows. And I want to thank our advocates, David Wright from Families USA, David Mitchell, is he here, from Patient from Potomac, and of course the great Leslie Dock, who I worked on passing the ACA with 15 years ago, and it's gotten better and better and better. And we don't want to reverse that trend, but we're here today to talk about prescription drugs. When you ask Americans what is bugging them, what is really ticking them off, at the very top of the list is the high cost of prescription drugs. Why? It's life and death for a lot of people. It's health. It's being able to go to work. It's being able to have enough ability to watch the kids or grandkids. And when you have to make the choice between paying through the nose for these expensive drugs or your own health, it's one of the most confounding decisions that everyday Americans have to make every day. And so we were so proud. As you know, in a little room, I negotiated the IRA with Manchin. And I was pleasantly surprised at how much we were able to do in terms of getting, for the first time, something we had been waiting for. I was on more teleconferences with AARP and seniors, and getting Medicare to be able to negotiate with these drug companies to bring the cost down. And as you've seen, the first 10 drugs were a huge success, and now we have another 10, including Ozempic and Wegovy and some of the others. That's going to reduce health. When you reduce the cost of those drugs and the ability to buy those drugs, you dramatically reduce the cost of health care. Because things like diabetes and other things which cost so much to take care of in their later stages aren't going to happen. And we put in the $2,000 cap. It was $3,200 last year. It's now $2,000. So that if you have a kid with cancer or a grandkid with cancer, you can afford that drug. People can afford that drug. So this is, what we did was amazing. It was groundbreaking. And when Donald Trump was on the campaign trail, and all of our Republican senators, they can tell you, were on the campaign trail and say, oh yes, we want to keep those costs down and reduce them. And within 2 days, in one of the first executive orders, they pulled the rug out from under what we did. 2 days. Didn't take them very long to do a total reversal and side with Big Pharma instead of siding with everyday hardworking Americans. And let me tell you, I met with Russell Vought yesterday. This guy is really dangerous in one of the most powerful, if not the most powerful agency. He's one of the authors of Project 2025, one of the leaders of Project 2025, and they want to get rid of the whole thing. No more cost of insulin at $35. No more limit of $2,000. No more negotiations to get the price of drugs like Ozempic and Wegovy down. Out. Why? Well, as Amy said, and I've been saying, it is a golden era in America for the very wealthy, including pharma and the pharmaceutical executives. It's a golden era for them, not for working families. And what we've been doing at the hearings and what you're going to hear us doing for the next years is show who this golden era is for. The very, very few, whether it's the oil companies or big corporations or very wealthy individuals, and certainly for Big Pharma, the golden age is for them, average American. Mr. America, Mrs. America, Ms. America, America, it ain't for you. It's for them, the golden era. And we're going to do everything we can, everything, all of us, to make sure that they don't get their wishes, to fight them every step of the way, to get those drug costs down, to get $35 insulin for everybody, to get a cap on prescription drugs for everybody. Let's see if they join us. Let's see if any of our Republican senators join us. We've got a lot of talk on the campaign trail, and not just inaction, but reversal of that within 2 days. Shame on them. Thank you, Amy. Thank you, everybody.
Thank you. Very good. Chuck just has a few things to do. We'll turn over to Senator Shaheen. Thank you.
It says David Mitchell.
Oh, David's next. Okay, thank you.
Thank you.
Thanks for sharing your story, David.
Good morning, Senators Schumer, Klobuchar, Welch, Shaheen, Gallego, Alsobrooks. Thank you all for your leadership. I'm David Mitchell. I'm a 74-year-old patient living with incurable blood cancer. And on October 12 of last year, I also became a stroke patient when I had a thankfully tiny stroke. I have no neurological deficits. Everything still works. That's a blessing. But my stroke, unfortunately, wasn't caused by a blood clot where they can just break it up and make it go away. It was caused by an 80% blockage in an artery on the right side of my brain. Now, the treatment with the best results is called medical management, and it relies on blood thinners and high-dose statins in order to lower cholesterol along with diet and exercise. So prescription drugs are keeping me alive in the face of both of these incurable conditions. Right now I take 4 cancer drugs, which carry a list price of more than $1 million a year. This year, the IRA is saving me more than $15,000 out of pocket on those drugs alone. It's truly life-changing. And my prices will come down dramatically through Medicare negotiation. The blood thinner I take is Eliquis, and its price was negotiated in the first round of 10 drugs. It was reduced by 56%. And one of the cancer drugs I take is on the list of 15 up for negotiation this year. The drug is called Pomalyst, and this little bottle of 21 capsules carries a list price of almost $24,000. You have to buy it 13 times a year because it's 21 capsules over 28 days. The savings from negotiation are making possible free vaccines, $35 a month insulin, and an annual out-of-pocket cap at $2,000, all the while keeping a robust pipeline for innovative new drugs patients like me want and need. So millions of patients like me are seeing huge savings, as are taxpayers, because of the IRA. We must continue to implement this law, which has broad bipartisan support across the country for more than 80% of Americans. Thank you for having me today to tell my story.
Okay, thanks. Thank you, Jeanne.
Well, thank you very much, David, for telling your story. Listening to you talk about the prescription drugs that have kept you alive remind me of my granddaughter. I have a granddaughter with type 1 diabetes, and without insulin, she would not be alive. And one of the groundbreaking provisions that we passed in the last session was the cap on $35 insulin for people on Medicare. Unfortunately, we need to make that $35 cap on insulin available to everybody who has insulin. And we need to make sure, let's put this in a bigger frame of health care and the importance of addressing the health care needs of the American people. Because one of the things that our family finds the most frustrating, and I bet you do too, David, is the fact that every year my granddaughter, who has type 1 diabetes, who if you know anything about type 1 diabetes, you know that it's a chronic illness. It doesn't go away. It's like your blood cancer. It's not going away. And yet every year the insurance company tells her she has to prove that she has type 1 diabetes. I mean, it's like it's hard to explain how frustrating that is, especially from people who are supposed to be there to ensure that the health care of my granddaughter and the people they represent is protected. Sadly, as we're looking at what we need to do to continue to address prescription drugs, what we're seeing is that our Republican colleagues and the Trump administration are starting to discuss tax breaks for the wealthiest people and biggest corporations, but they're not talking about how to continue to keep down the cost of prescription drugs for Americans. I saw an interesting ad this morning where President Trump was taking credit for reducing the cost of prescription drugs, and he just got into office and just signed those executive orders that Senator Klobuchar talked about. What we know is that we need to address the cost of prescription drugs. We have a family in New Hampshire from Hollis who sadly are also dealing with diabetes. Amy and Lily Brady. Amy's mother passed away from diabetes related to complications and mismanagement of her system because she couldn't get affordable insulin. Amy's daughter Lily also has type 1, and they're not sure that they can continue to address the challenges from her disease. Now, thankfully, Amy is able to manage the current cost of her daughter's insulin, thanks in part to steps that we're talking about this morning to lower the cost of prescription drugs. But as we know, not all families are so fortunate. And in the last 4 years, we have made tremendous progress to lower the costs of prescription drugs. And there are real opportunities for us to continue that progress. But we need to work together. It's one of the reasons that I introduced legislation to make permanent the premium tax credits to allow more people to afford the cost of health insurance. But the cost of prescription drugs is a big piece of that. We stand here ready to work with our colleagues in the Senate, in the House, with the Trump administration to keep lowering those costs of prescription drugs. We want them to come to the table to work with us. Thank you, Senator Welch.
Thank you very much, my colleagues and advocates. You know, I listened carefully to President Trump's inaugural address, and I watched carefully about his executive orders and pardons. There was something missing, despite all the talk about a golden age. It was a golden age of affordability. How are families going to afford housing? How are families going to afford child care? How are families going to afford their health care premiums? And you know, that's the day-to-day challenge that the folks we represent face, whether it's in a red state or a blue state. And one of the biggest causes of anxiety for all families is how can they afford health care? And Senator Shaheen mentioned that family where they have a beautiful child who's got type 1 diabetes. And every year they have to have a fight about whether that child has a chronic disease that never goes away. I didn't hear anything from President Trump or read anything about his concern for that. What we did with the legislation that Amy Klobuchar championed for years is finally have our government stand up for everyday Americans who had no control, no power over getting the life-saving medications that the people they love needed. And the pharma companies have enormous pricing power. They've got a patent that gives them the ability to charge whatever they want. They've got government-sponsored health care and employer-sponsored health care. And they create some life-saving drugs, but then they stick it to us all on the cost. That's not right. And when we passed the prescription drug price negotiation, we were finally, as a government, doing something that all other governments do on behalf of their citizens. Stick up for them when they're getting ripped off by rip-off prices. And what we're seeing is the Trump administration trying to roll that back. We're against that. You know, when President Trump was in his first term, in April of 2017, Elijah Cummings and I went to the White House to discuss with him prescription drugs and the prices. And he said he was for international reference pricing. You know what? So am I. But that was 2017. It's now 2025. Where is it? What is the White House going to do? Talk or deliver? All the indications are is that that was yesterday, and they don't care about the reality of today. We cannot continue to subject the people that we represent, and it's Republicans and Democrats, hardworking families, who want to have the security that they can get the medication they need for the people they love, and allow a fallback, a retreat, on having government stand up for price negotiation and lower prices. So I'm proud to work with all of my colleagues to stand up for everyday Americans who love their families.
Very good. Thanks, Peter. Ruben from the state of Arizona that has a few seniors.
Thank you. Well, thank you so much. And look, I just got off a 2-year campaign where I traveled the state, and I talked to seniors in all of the state, Democrat, Republicans, and Independents. And the one thing they were talking to about is they look forward to the days of having security, knowing that they're going to have access to affordable and life-saving pharmaceuticals, that they didn't have to drive to Mexico anymore to buy American-made prescriptions that were cheaper in Mexico, because Mexican government actually negotiates for their citizens, unlike the United States. So what we're seeing right now is the priorities of the Trump administration. They're going to cut the support for these life-saving prescriptions for our seniors in order for them to be able to afford these tax cuts for the super rich. That's exactly what's going to be happening if we don't stop them. So we're going to make our seniors who have worked decades to have some level of stability support the 1% to have these mega tax cuts. And that is what Donald Trump and his administration is going to say is their priority. And that will cost lives again. So please, everyone, join us and make sure that we stop this. Thank you.
Okay, very good. Angela.
Good morning. First, I'd like to thank my colleagues and others who are here today to speak on behalf of the American people. That's what this is about. Like Senator Gallego, I had the opportunity to spend a couple of years on a campaign trail talking to Marylanders who shared with me their concerns about economic opportunity. The ones who said that they simply wanted their government to provide for them an opportunity to live the American dream, to be able to afford the basic necessities, housing, medication, prescriptions, to be able to afford education for their children. And so I'm here on their behalf today. I'm also here to speak on behalf of what I will call the 48 million. There are 48 million family caregivers in the United States of America. It just happens that my father is one of the 48 million, caring for his wife of 55 years, my mother, who is suffering from various health conditions. And it is my father that, in the midst of caring for my mother, spent a really distressing couple of months at the kitchen table last year. And that was as a result of his own diagnosis of a heart arrhythmia that required a prescription of Eliquis. It wasn't until that diagnosis that I learned that Eliquis was $800. You can only imagine the distress my father experienced when he sat on the phone literally for months trying to talk to the insurance company to do what he could to afford a medication that I think we can all agree is unaffordable for the average American. And so I thank all of my colleagues who have worked over the last few years to make sure that the Inflation Reduction Act covered medications like Eliquis that you heard David say now is reduced by 56%. This is life-changing. This is absolutely life-changing for the average American. And so I will continue to fight along with my colleagues, and I encourage my colleagues on the other side of the aisle to also center at everything we do, the lives of those who depend on us, who don't care, to be honest with you, one way or the other, whether we are from a red or blue state, who don't care whether we are Democrat or Republican. When someone you love is sick, you want them to have the life-saving medications that they need, be it for your grandchild or your spouse. It is most important. And I'll finally end on this again, is that we should just always remember as well that the public made it very clear to us that they want to be able to afford to live day in and day out. And so in everything that we do, we know that we have celebrated the billionaires who are now taking over in many ways our government. And I hope that in everything we do, we never forget the people who sent us here and forget that their lives depend on the work that we do. Thank you.
Thanks, Angela. Anthony Wright of Family Families USA. Thank you.
Thank you, Senator. Again, my name is Anthony Wright, Executive Director of Families USA, the longtime nonpartisan healthcare consumer advocacy organization fighting for affordable, quality health care for all. I just come from a conference with over 600 advocates from around the country who work for decades on Medicare prescription drug negotiation, and we're not going to let the current administration roll back 5 years of progress under the IRA, 15 years under the Affordable Care Act, or 50 years under Medicaid and Medicare. If Americans voted on anything this past election, it was on affordability. And if they complained about the price of chicken or eggs, in this past year, they've been screaming about the price of prescription drugs and health care for decades. So in contrast to the message of affordability that voters set their representatives, the proposals of Republican lawmakers so far, like cutting hundreds of billions of dollars from Medicaid, would actually shift and raise the cost to working families, threaten the health and financial security of millions across the country. And that's what any effort to undermine the Inflation Reduction Act would do. The reforms passed in the Inflation Reduction Act by the senators here, particularly the Medicare negotiation program, is one of our most effective tools to address high and rising healthcare and prescription drug costs. The first 10 drugs already negotiated will save $1.5 billion in out-of-pocket expenses in 2026 for those who rely on Medicare. Another 15 drugs were announced last week, and we can ensure that those drugs, which treat diabetes and cancer and asthma and many other chronic conditions, are just as robustly negotiated to ensure the lowest possible price. So there is more to do. Today, Families USA is releasing an affordability agenda, a list of vetted recommendations that will lower the cost of health care for millions of families and generate billions of dollars in savings for federal and state budgets. That agenda includes reforms championed by Senators Klobuchar, Welch, and Blumenthal to our patent system to take on big pharma and their abusive behavior, the system that reduces competition and allows corporate executives to set high costs and raise them year over year. But it also includes other efforts to strengthen and expand Medicare drug negotiations so we can get more drugs to more people and more discounts. So we want to take serious action on lowering costs. If President Trump is serious about lowering costs, he should double down on prescription drug price negotiation and also call on Congress to do other things like extend the tax credits. Otherwise, Congress would give the green light for a surge in premium costs, a surge in prescription drug costs, and we'll see premiums go up, we'll see prescription drug costs go up. So again, Families USA stands ready to work with these senators and anybody who is serious about lowering costs so we can get to an actual affordability agenda that the voters have actually demanded this past November. Thank you very much.
Very good. Thank you. Leslie, Doc?
I'll be very brief. I know people have been here and listening. Healthcare is the kitchen table issue in America. It's an economic issue, and when you get sick, it's a matter of life and death. It takes over the families. There is nothing more emotional that happens when one of your members of your family is sick and you can't afford the health care they need. Imagine that. Senators that were here today are leading the way to reduce costs, expand coverage, and stand up for everyday Americans who need to be able to afford the health care to stay alive that they can't afford today. The contrast between what this agenda is and the agenda of this White House couldn't be starker. Democrats are for lowering prices and expanding coverage. Republicans are for increasing prices and kicking people off the rolls. Millions of Americans, 172 million Americans, are covered by these essential programs, Medicare, Medicaid, and the Affordable Care Act. We will do everything we can to protect them. These are nonpartisan issues everywhere around the country except in Washington, D.C. People, no matter where they live, what they do, what party they belong to, support the Democratic agenda, and it is time that Republicans do the same. Thank you.
Okay. I think we will, if anyone has questions on this topic, we're available. Anything? Yeah?
So, his first term, President Trump talked a lot about his complaint that other countries were paying much less for prescription drugs than we are. That's still the case today. I also talked to Robert Kennedy and asked him about working with you guys
So we have made it very clear we will seek common ground when we can, and if they want to work with us on not just, as Senator Welch pointed out, taking these next 15 drugs and making sure they get negotiated to the degree they were with the Biden administration, we want to work with them. We'd like to expand the number of drugs. That'd be great. If they want to work with us on a bill to include all the drugs, that would be good. But we haven't heard that from any Republicans in the Senate, and in fact, they voted, every one of them voted against the prescription drug negotiation bill that we had, and a number of other votes that were similar in the past. We will stand our ground when it comes to protecting the American people and accountability, and that's what this is about today. We have already seen some bad signs with the executive order when it comes to, say, a pilot for $2 generic drugs for seniors. We've seen things coming out of the Ways and Means Committee of the House, which actually would undermine and mess around with the existing prescription drug negotiation program. So there will be, I'm sure, a lot of questions of that nominee when it comes to prescription drugs. But in the end, when President Trump was in the last time, there was a lot of talk about prescription drugs, but there was no action. What did Democrats do? Against all odds, with a very small margin in the U.S. Senate, we actually passed the bill to finally lift the sweetheart deal that pharma had gotten for 20 years. So they want to work with us, fine, but I'm telling you right now, it was the Democrats that brought the action. It's the Democrats that are going to stand up to them. And if the last week is any sign, the golden age seems to be about some golden boys. And so we would really, really like to make sure that this extends, that this is about affordability. You want to? Yep.
And building off of that, even if you are able to get Republicans on your side on this, there's still no guarantee that the president will actually take the bill and put a signature across it. So at this point, is the concern more so in action from the Trump presidency on the future prospects of drugs, or is there the fear that he could do something to roll back on the efforts that he already want?
Right. It is on both ends, right? Inaction would mean that we're not going to get the negotiations we want. This was a huge amount of work by Secretary Becerra. This was a huge amount of work by the Biden administration. Can you imagine negotiating with these pharmaceutical companies, some of the biggest companies the world has ever known? And also at the same time, even with the negotiations being done and baked in, they are suing in 10 different jurisdictions across the country to undermine this plan. So this is going to take the Trump administration fighting those lawsuits. It's going to take them negotiating these drug prices and making it a huge priority of theirs. And then it's going to also, if you want action, we've got all kinds of actions we think they should take. So it's going to be on both fronts. Clearly, the status quo isn't what we want it to be, but the trajectory for the drug negotiations, when the first one showed 60, 70% in reductions, we should be doing this for all drugs. And if they're ready to join us on that, great. I don't think we're seeing those signs at all. We're seeing the House trying to undermine it. Do you want to add anything, Peter? Okay, anything? I think that's it.
Thank you.
Okay, thank you. Appreciate it. All right.
Thank you, Senator.
Hey,
Thank you for your leadership.